What if both the central incisors are missing? Let's understand the restorative options for the same. Don't forget to save it. Don't forget to share it. First question, what is the growth status? If the patient is still growing, avoid implants as there is a risk of infra-occlusion and gingival margin disharmony as the adjacent teeth continue erupting. Use interim restorations like an Essix or a flipper or resin bonded options until the growth is complete. However, if the growth is complete, the most tooth preserving, high aesthetic, long-term plan is usually 2 implants plus 2 single crowns with meticulous 3D placement, soft and hard tissue management and provisionalization. Avoid 1 implant with a 2-unit cantilever in the aesthetic zone unless biomechanics and occlusion are exceptionally favorable. Always carries a risk of overloading, screw loosening and aesthetic complications is higher than 2 implants in many cases. You must plan for papilla and midline tissue stability. Inter-implant bone crest remodeling can flatten the inter-implant papilla more than the tooth to the implant situations. This is why soft tissue phenotype, implant spacing and provisional contouring matters enormously. Clinical decision guide. Diagnose what will make or break your results. High smile line plus gingival display. High smile line is equal to aesthetics, which is unforgiving. You must prioritize tissue stability, emergence profile and papilla management. Soft tissue phenotype plus keratinized mucosa plus its thickness. Thin phenotype increases recession risk. Soft tissue augmentation may be indicated in high demand aesthetic sites. Ridge volume plus midline defect pattern CBCT essential. Both centrals missing often means a midline ridge deficiency or a scar tissue, especially with a history of trauma or traumatic extractions. Implant positioning must be prosthetically driven. Occlusion plus parafunction. Deep bite, edge-to-edge bite, heavy guidance, bruxism, higher mechanical complication risk. Option B, implant supported bridge, usually on 2 implants supporting both the centrals. It is best when you want implants but need to control the symmetry or the contours, or when implant positioning or the space availability makes 2 separate crowns less favorable. Orthodontic space closure with substitutions and interdisciplinary approach. Best, especially in young patients or when implants are contraindicated and when facial profile or occlusion allows space closure. So move the laterals into the central position, canines into the lateral position, then reshape or recontour or have restorative options.